An anal fistula is a small tunnel that develops between the end of the bowel and the skin near the anus. They are usually the result of an infection near the anus, causing a collection of pus in the nearby tissue. And for more on what perineal abscess and fistula is, I am joined by Dr. Jeremy Nel from Jeremy Nel Medical Practice. Good evening and welcome to the Daily Roundup.
Evening, I'm glad to be here.
So tell us, what is a perineal abscess and fistula and how common is it?
Okay, an abscess is basically a collection of pus. So that usually presents itself either on the skin or inside the anal canal. That presents on the skin you can see from the outside. That inside the canal you obviously can't see from outside. It's inside the anus. And it's usually very common. We do about 3 or 4 a month.
Right.
You know, we don't have figures for Namibia, but I can tell you what the United States figures are. They are about 365 million people, and they have 100,000 abscesses a year. So you can imagine how common it is. Yes.
Sure. So what is the difference between fistula and perineal abscess?
Okay. What normally there's a gland that lies between. I think you saw the video before. There's a gland inside the anus that supplies the anal canal with like a mucus.
Okay.
So when you pass stool, it's not so uncomfortable. Now, if that gland gets blocked or you get infection inside there, then you get a formation of pus.
Mm-hmm.
That's an abscess.
Mm-hmm.
If the abscess is neglected and not treated properly, then it will either drain itself, either towards the skin or towards the anal canal. And if it does it both ways, then you get what's called a fistula. In other words, you've got an abnormal pipe or connection between the skin on the outside and the mucosa or the lining of the inside. So what normally happens with that is that once it drains, the pain goes away, but you're left with an abnormal connection. And then when the skin heals, then it basically builds up again, gives you a lot of pain, and then it discharges again, and then your pain goes away. So we'll get to it later, how important it is to treat it properly.
Yes. So what are the major causes of perineal abscesses?
I think the most important thing is to have good hygiene. So I think when you go to the toilet, it's very important to make sure that your anus is clean afterwards, and that you wash your anus at least once a day after stool with soap and water, so that it's absolutely clean. If you have too much hair, it might also be a good idea to shave some of the hair off so that it doesn't catch the stool and make it unhygienic.
What about the diet?
I don't think your diet really has an effect. You know, obviously, the more constipated you are, the more likely you are to traumatize the anus, making it more likely to block and then to form an abscess.
So what is the risk of developing a perineal abscess or a fistula?
Well, there are certain risk factors, as I said, hygiene, and there are obviously some diseases that make you more likely to get it, and if you do get it, make it more severe. So one would think in our country, you know, something like being immune compromised, having chemotherapy, being obese, having HIV, having diabetes mellitus, those are probably the major risk factors. And we do sometimes have a disease of the bowel, we call it Crohn's disease. It's basically an autoimmune disease that destroys the bowel, and you get a lot of connections between skin and bowel canal.
Right. So what health conditions might put you at a higher risk for developing an abscess in your perineal area? And
I think those are the ones I sort of mentioned. Yeah, I think that's them.
And what other risk factors can lead to abscess, fistula, other than the ones you've already mentioned? Yes,
I think the important message to take home here is that the treatment of a perianal abscess is an emergency. Okay? Right. So if you get a perianal abscess, you must have it drained. Okay. If you go to somebody and they give you antibiotics, then you need to look for another doctor, because you cannot treat a perianal abscess with antibiotics. Antibiotics play a role, but it's only after you've drained the pus. If you leave it and it drains by itself, then you're probably going to get a fistula. So we like to prevent that, you know. I think that is probably the most important message that you're going to get tonight.
So what tips can you leave us with on how to better care for ourselves to avoid this?
As I said, your anal hygiene, very important. And second of all, to not neglect the abscess, okay? Especially if you've got diabetes or hypertension and you're obese, things like that. Because you can, we actually lose patients from this condition. Yeah.
Well, thank you so much for enlightening us. Well, that was Dr. Jeremy Nel from the Jeremy Nel Medical Practice talking to us on perianal abscess and fistula. Don't go away.